My philosophy has always been treat every patient with compassion in the sense that you treat them as if they were your family.
The geriatric setting is the most fulfilling for me because it really allows us to see patients at their most vulnerable level when they're really sick and they might not want to do therapy, but they'll still come to us, we'll still help them get better, and you get to see, I feel like, more progress.
These people here have the way to work with you. And I was so well treated. In a matter of 2 weeks, I was out of here. And when I left, I was pain-free, and I was walking pain-free.
One of the most important things is getting people back to their normal daily lives, whether it be work, whether it be sports activities, whether it be being able to walk to the grocery store, being able to go to the doctor independently.
5 years prior to my back surgery, I was probably restricted at least 50%. I put it off as long as I could, had the surgery, and within 3 months of therapy, I was at 85%. And within a year, I was at 100%. And I have continued to be at full capacity since then. I'm very active. I have grain bins. I'm up and down the grain bins all day long, which is something that I just could not do prior to me having the surgery and the therapy.
I had a total knee replacement, and within the first 6 weeks, I had attained the goals that they wanted me to have. Everybody was just very, very helpful. I never felt like I was on my own at all. I think that without the therapy that I ended up having, I certainly would not be where I am today. It was most helpful.